Pure Country C106.1, Vince Gill, Reba McIntyre, Oklahoma Swing, 9:15. Good morning, your bud Doug here, and right over there across from me in the studio here across the console is our good buddy Dr. Alex Rodewald with Kessinger Specific Chiropractic at 1424 Curry Lane in Cape Girardeau. We are good to go with another Health Talk Thursday, and Dr. Alex and I were talking about emojis here just a moment ago. I can't help to wonder, Dr. Alex, is there an emoji for chiropractic?
Not to my knowledge, no.
There should be.
There's a doctor emoji, a guy with a white coat on, but yeah.
Oh, really?
I don't know about a chiropractor specifically.
Well, you never know. We may have emojis for everything.
There might be one of a bone. I'm not sure.
Of a bone?
Yeah, maybe a vertebrae or something.
Oh, okay. Well, there we go.
I don't know.
They're getting close, but
I use a lot of emojis.
Dr. Alex Rodewald with Kessinger Specific Chiropractic wanted to talk about neck and back pain, and just the thought of that with folks with a crick in their neck this morning or some back pain. Probably not the best news they want to hear, but you're going to give them great news in the way of helping them. Because you guys do such a great job, and you teach us to allow our bodies to heal themselves.
Yeah, I mean, we've talked about tons and tons of different conditions on the show here, and we treat a variety of different conditions in the office. And the neck and back pain are our really wheelhouses, if you will. It's kind of one of the things that we excel in or exceed in. It's one of the things that we're known for treating as chiropractors, and so it's something that really can be ongoing for a lot of people. Some people have back pain, neck pain for years and years and years before they start to do something about it, and it's much easier to fix something once it starts early rather than waiting 10, 15 years down the road and then we're in a worse situation. And there's different causes for different types of pain, and so that's our job, is to figure out why it's happening and can we fix it, can we correct it without really covering it up with medications.
And a lot of your patients who suffer from neck and back pain don't necessarily suffer with that pain as a result of an injury every time, do they? They can just maybe sleep a little crooked or something.
Right, yeah, and usually, we have people in the office with injuries, people who've herniated discs, they've been in car crashes, they fell off a ladder or whatever it may be. But yeah, you can have back pain that just kind of creeps up on you throughout the years and gets worse and worse and worse over the years, and it may not be due to an injury. Sometimes it can be due to an injury you had many, many years ago. A lot of times our bodies are good at adapting, they're good at healing like we talked about, but sometimes there's something going wrong in the spine for a long, long time before we actually start to have pain. And so our job, like I said, is to figure out why that's happening and what we can do about it, and before it gets too late, because there's stages, people's injuries, people's degeneration, arthritis and stuff in the spine, and there comes a point where there's nothing that we can do. And so we really want to see people early on in this, so there is something we can do and we don't have to go down the road of surgery or injections and drugs and things like that.
Well, I remember when I saw you guys back in 2016, I guess it was, and you took those x-rays.
Yeah.
You open your mouth and you put that cork in your mouth. Of course, the cork is covered with a plastic baggie for your sanitation purposes. But anyway, I had no idea I had spurs in my neck, and that was probably, as you mentioned, from an injury a long time ago.
Right.
And I thought as a kid I always wanted to wear spurs, but not in my neck.
Yeah, that's why we take x-rays, because we want to see exactly what's going on, if there is any degeneration, bone spurring, arthritis type of things, old injuries that we need to take into account, so that we can really tell the person this is what it's going to take, this is how long it's going to take, or whatever it may be. Or maybe it's an easy fix. We always hope it's an easy fix, but we really want to get the details so that we can actually see what we're working on. We can rule out all doubts. We can take out all the guesswork and know exactly what we're doing and why we're doing it.
It's coming up on 9:20 with your bud Doug here. Happy first day of summer 2018, by the way. Hope you're faring well. If you're just joining us, we have Dr. Alex Rodewald in the house with us, as we do every Thursday morning at 9:15 for another great Health Talk Thursday. And wanted to talk a moment about, with regard to neck and back pain, which is the topic this morning, the upper cervical procedure that you guys do on patients. You're not going to find that everywhere.
You won't find that anywhere in the area, in probably the listening area. I think the closest person that does it to us is down in Memphis, maybe in St. Louis. There are some in St. Louis. So both of those ways, but we're the only ones that do it in the area. And it's a unique approach. It's a unique way to look at things and way to adjust things. And that's why we can get unique results with it. We have people who've been elsewhere. They've been through physical therapy. They've been to other places, and they haven't gotten the results that they want or that they need. And through our upper cervical procedure, adjusting procedures, we do a very in-depth analysis of the x-rays so we can get very specific adjustments to help people get healthy and well. And so yeah, that upper cervical analysis and adjusting procedure is very key to what we do, and that's what we kind of specialize in the office.
And that x-ray procedure that I mentioned earlier, I had never had an x-ray above, I guess, the top of my spine before, because in past visits with chiropractors over the years, I'd never seen my neck bones like that. And it really blew me away.
Yeah,
because when you seeing is believing, and when you see it, it really puts things into perspective. Like, okay, I've got to do something.
That's why we take X-rays, because so that we can, I can't see the spine. We can judge things based on just looking at the spine from the outside, looking at musculature, if there's any muscle spasms, things, how the motion's feeling in the spine, that type of stuff, as chiropractors would normally do. But not all chiropractors take x-rays, and I think it's very crucial to what we do, because there's things that we see on the x-ray that we would have never known if we would not have taken the x-ray, and so they kind of change sometimes how we approach things, how we do things. So they're very important to us so that we know, that we're doing the right thing, that we're making the right correction in the right way so that we can get the best results. And then, like you said, you can have people who don't have pain, but they are having bone spurring, forming, and disc thinning and stuff like that, and so it's much easier to catch that, and so we can stop it from happening further rather than waiting till it's all the way down the road and causing a bunch of issues and a bunch of pain. And then a lot of times there's only so much that we can do.
And not knowing what's going on, boy, that's something that'll work against us, because you look at the x-ray and whoop, there it is right there for you to see.
Yeah, we want to take out all the guesswork. We don't do any guessing in our office. We don't guess. We take the x-rays, we look, and we don't guess at people's, giving them different types of recommendations as far as eating or supplementation goes. We do blood work in the office to look and see exactly what's going on under the hood, if you will, because there's things on there that you may not know about. That's, like I said, much easier to fix before there are major symptoms, major issues down the road.
And with regard to the back x-rays, I remember seeing the x-ray of my lower back, and it looked kind of like a ladder with some missing rungs on it, because it was just all over the place. And boy, when you see something like that, you can again get a good assessment of what you need to do as far as what your treatment entails.
That's right. Yeah, you can probably lean back in your chair or twist yourself around and make something pop, make a noise. It may make it feel better for the time being, but usually it comes back the next day or whatever it may be. And so that's, again, why we take x-rays, so we can see for sure how to adjust people in a very specific manner, in a very specific way. And that's why we went to school to do what we do, so that we can get things back on track and do things in a very specific way.
And again, with regard to the pain medication, for those who don't know, you swallow the pill, it gets into your bloodstream, goes to your brain, and kind of tricks your brain, doesn't it, Dr. Alex?
Yeah, it's not fixing anything. It's not fixing the problem. If you have a disc herniation, or you have a vertebrae out of position, or you have a nerve that's being pinched upon, if you take a medication, it probably will make you feel better, but it's really taking away that pain signal, that nerve signal to the brain that says, hey, I have pain. It's not fixing the actual problem. And so the typical progression is, hey, I have back pain, and then I take some medications. It goes away for a little bit, but then it comes back, and this has been going on for 6 months. And then we do x-rays, we do MRI, we see that we have a disc herniation. Hey, let's try physical therapy. That didn't work. Let's try injections. Those worked for a little bit, and then they stopped working, and then we're at a point where the only option is surgery most of the time. So we've seen people in all gamuts, all aspects of this whole gamut, if you will, from the beginning to the end, and we've done good work with a lot of them. And so we can see people who are told they have to have surgery, and we've got people out of surgeries, and we can see people who would just hurt their back yesterday, and we can do things with that as well.
And you had just mentioned something that reminded me of what you reminded everyone about. You have on many an occasion here on Health Talk Thursday, those 5 words that can work against you, which are?
Maybe it will go away. Yeah, and like you said, maybe you slept wrong or whatever it may be. Typically, unless you really did sleep wrong in a very, very, very weird position, it may cause you some aches and pains, and it may go away. But a lot of times there's something going on in the spine, something's wrong with the spine that's not allowing you to sleep properly, that's not allowing you to move properly, and it's going to create irritation, it's going to create pain. And these are things that we can do a lot of good work with and help people get better spines, healthier spines, better structure to the spines, and not just feeling better, but better for the future as well.
Reminds me of the problem with the starter on my car for the last week. Well, I got it fixed yesterday, thank the good Lord above. But I kept telling myself, maybe it'll be okay. You know, maybe
Yeah.
maybe it'll be all right. But we don't want to have that approach toward our bodies.
That's right. We use that analogy in the office sometimes. You know, we don't want to put duct tape over our check engine light. It's a symptom.
Right.
It's a symptom. So kind of like what you're doing there.
Just make sure it's black duct tape, so it
that's what people tell
hides
me. Yeah.
and camouflages
Right.
into the instrument cluster there. But
Yeah, I mean, just like your car, if you have that check engine light, your check engine light in your body is some sort of symptom, whether it's pain or fatigue or headache or whatever it is. That's your check engine light that's saying, hey, something's wrong, something needs to be checked out, something needs to be fixed, and that's where we come in to investigate why that's on there. And taking medication is just pretty much putting duct tape over that, you know, making it go away for the time being, but it's still there, the problem's still there, and so you're pretty much prolonging things, and we don't want that engine to explode down the road, so to speak. So yeah.
And for those who may have the wrong impression, you do not yet anyway, have the ability to place a check engine light on someone's forehead.
We do not, and we do not work on cars.
Do you do windows?
No.
I'm kidding. But Dr. Alex Rodewald with Kessinger Specific Chiropractic. Boy, how time flies. I have to ask you, the special, will you offer that again?
Yeah, like we've done in the past. It's gone well for people. We do our exam, our consultation initially when somebody comes in to figure out what's going on, whether it's back pain, neck pain, or it's headaches, or it's fibromyalgia, or it's digestive issues, whatever it is, so that we can figure out what's going on, and then we will take X-rays if we need to, based on our exam, and all of that usually is about $180. But we want to offer it to anybody who wants to call in today for $27.
How sweet it is. Boy, you owe it to yourself for such a great value, and you can find out so much for that $27, can't you?
And that's right. Yeah, we can find out what's going on, and if we do our exam, we do our consultation, we take the X-rays, and the X-rays look perfect, then we can send you to somebody who that we know that may be able to help you with your different condition that we can't help. But typically, especially with neck pain and back pain, there's a lot that we can do. Rarely does somebody have an issue with the neck or the back that we can't at least help out a little bit.
And all they have to do is call or stop in today. When do you close the doors today, Dr.
About 6 o'clock.
Okie doke. So if they call late, let's say it's 5:45 or something like that, or you got
Yeah.
someone stopping by at like 5:30 or 5:45, you're not able to get them in, you can honor that special price at a future scheduled appointment.
That's right. Whether it's tomorrow or a week from now or a month from now, yeah, we can get them on the schedule.
Good dealio. Give them a call, 573-334-0100. That's 334-0100. And of course, you'll find Kessinger Specific Chiropractic off Kings Highway, across the street from Ford Groves, behind the Ford Groves Body Shop, and across the street from McCombs Funeral Home at 1424 Curry Lane in Cape Girardeau. Dr. Alex, thank you so much again, and thanks to our folks on Facebook Live.
Yeah.
Appreciate the folks tuning in, and it's always educational, always informative, and have a little bit of fun too. And I like that part of the deal too. So, thank you, Dr. Alex. God bless you, and happy first day of summer.
Thank you.